Hi, Jess. How's it going?
Good. It's been a while.
It's been a long while.
It has. Should we update our audience on some of the exciting or not so exciting things happening?
I think all the updates are yours to give, so
All right.
have at it if you want.
Well, as you can see, we're together in person again, in our halfway put together studio. So,
Yes.
please excuse our,
Transition period.
yes, transition period. But my boys and I just moved outside of beautiful Austin, Texas, and you will see a lot more of us recording in person together. Other updates. That's a pretty big one.
That's a huge one, I would say. Yeah.
Yeah, so we're still in the process of getting enrolled in school, getting situated. We've been here just over a week or so.
I think, yeah.
Yeah, and learning the area. So Texas has been wonderful so far.
A lot warmer.
Definitely a lot warmer. It's 90 degrees today. It has not rained since we got here, which I'm not complaining about. And yeah, it gets to be daylight a lot later and it gets dark a lot later. But today we're going to talk about autism.
Yes.
You want to give a quick run through of what's on the agenda?
Okay. Well, I think we're going to attack autism as what we're calling a gateway diagnosis. Why, I won't say why the label, but why a label matters.
Yep.
Especially in the context of those of us with kids that have a diagnosis that does not have a clean label, I'll say, right? And, all the things that come along with that, I'll say inequality, but challenges in getting services or therapies, depending on what your diagnosis is or is not. And if we tend to try and push, or as parents or caregivers push or overuse a diagnosis as a way to get services and such. And then, see what you guys all think about all that and what your opinions are too.
Yeah, we'd love to hear that. So we have a golden ticket, as I like to call the autism diagnosis. So Avery has a golden ticket. Do you have kids with a golden ticket?
Out of the 5, we have one.
One
golden ticket.
One golden ticket.
And I'll say it was somewhat grudgingly given.
Okay.
After many years of trying to get an autism diagnosis for all of them, but we'll just take this one child in particular. But and not because we saw it as the golden ticket, but just because to us who see the behaviors and the interactions and all the things on a daily basis, it's like, oh yeah, totally. But in a clinical setting with pediatricians, doctors, and even at school where they see them for hours during the day, there weren't the stereotypical key indicators or behaviors for an autism diagnosis. So it was always kind of like, nah, she doesn't have that.
See, I would argue and say that with early intervention, Avery received his autism diagnosis just before his 2nd birthday, and he did show pretty typical lack of social interaction, lack of verbal language, lack of eye contact, and then some of the other more idiosyncratic things that come with autism, he definitely exhibits. But
I'm sorry, how old did you say he was when we got?
Just before 2.
Okay, ours was when she was 13.
Wow.
Just for context.
Yes, so we know this is a big topic of discussion, which is why we're talking about it. And I think you would agree with me on this, that it's really hard. We have the diagnosis because it gives us the greatest breadth of services and access to services, because our kids' genetic condition is not yet recognized so that they are eligible for services. And that is incredibly sad. That's not to say that I don't think the autism diagnosis is fitting, because we know, as many of you know one kid with autism, one kid with autism. And that's true for our kids. One of our kids, one of them.
Right.
They're very different. But I also think that there are, some things about our kids that are truer to the genetic condition and less related to autism.
Oh, yeah, totally. This is going a little off plan, but I'll say it's relevant because we were actually talking about this earlier today. Now that you guys are here and you're trying to move Avery's, plan of care to here, excuse me, I'm getting over a cold still. With things like Medicaid, right, you're going down that path for him because he has services already.
Yes.
From where you moved from. And we've tried to go down that path here for our kids. And despite the fact that the majority of them can't talk, can't bathe, toilet, those sorts of things on their own, for services here in Texas, for lack of a better term, they're not disabled enough to qualify.
Yeah. And that's heartbreaking, right? Because the reality is Avery probably, I guess I can't say fairly if he would or would not have qualified, but his automatic qualifier, even into investigating what was going on, is being a child in foster care. And he had a failure to thrive global developmental delay diagnosis. And those two things together gave us kind of permission to run with genetics testing and to seek treatment with a developmental physician, and then later, of course, to get services at no cost. And because he's adopted from foster care in Tennessee, his medical coverage is through Tennessee's Medicaid program. Now, that does not cover him in Texas, and that's a journey that we're embarking on now to figure out, does he go on employer insurance? Do I try for Texas Medicaid? And so if any of you listeners out there have some advice or tips on this, please reach out and let us know. This is definitely real time.
Yes.
Well, real world, real time problems.
Yes. Yeah. Like I said, we were talking about it today.
Yes. So let's talk a little bit about why it matters. I know I touched on this and I call it the golden ticket. No, are you Willy Wonka? I can be Willy Wonka. I love
chocolate. Yeah.
Love chocolate. Yeah. So why don't you talk about why you think the diagnosis matters? And I'll probably sit here and nod because I think we're on the same page with this as well.
Yeah, it's not a long explanation. I think, from my experience, both in terms of services to the school, as well as, we came from California before Texas, and, our experience out there is, services that the state would provide there. And even here in Texas where services aren't so fantastic, there are services available if you have an autism diagnosis that are not as easily accessible as if you don't. And I think that's why where people tend to say the golden ticket, right? Because it's a easily identifiable diagnosis in terms of name, at least, where you can say, oh, my child has this. And then people understand that that's a thing and that this menu of services can potentially come along with it. If I go to them for any of the other 4 kids, even though all 5 of them have the same diagnosis, if I go to them for any of the other 4 kids and say, oh yeah, my child has KDM5C, they're like, KDF what?
Yeah.
Right?
Yeah.
And it's an uphill battle. It's already an uphill battle, but it's an uphill battle and the hill has grease on it or something. I don't know.
Yeah, it is definitely a relief. And many of you will identify with this because when I say a relief, like getting services, I knew Avery needed PT, OT, feeding, speech, ABA, all of Avery's teachers, and here they come. Hi. All of Avery's teachers, peers, people recognize that he does need the therapies, and he's been in therapy since he was 14 months old.
That's really early.
So, yeah, when we say early intervention, foster care did definitely provide early intervention and services. But when we got the diagnosis, that's when looking at preschool and the special needs preschool, you want your vest on? You want to show everybody your vest? Yes, I do. The autism diagnosis is the number one thing on his IEP for services. So
even above like intellectual disability, which is our number one.
That's second for us.
Really?
Yes.
Interesting.
Yep. Coming from Tennessee. So I think the two can be not interchangeable, but when you have 2 pretty significant diagnoses, they they take into consideration both, but both of those, autism 1 or ASD, autism spectrum disorder, and 2, intellectual disability. Those 2 go hand in hand with the services offered through the school. And I would say that excludes ABA therapy in most cases, unless you have an external referral. So am I correct?
I think so. I mean, we've made the choice to date, at least, not to pursue ABA, but yeah, I think that's accurate.
Yeah. And that's one of the differences in our kids too, is Avery did start ABA and was in an ABA program for almost 6 months before we relocated. And the primary focus in ABA has been communication. That has been my number one goal for him across the board, is to meet him where he is on communicating and figure out which method of communication or communications, which methods of communication work best for him. And let's figure out how to help him say what he feels like he needs to say.
Yeah. Or I mean, say what he needs, right?
Yes.
Not even say what he is thinking or wants to express. What do you need?
Yeah.
Like, where does it hurt? If you're injured, where does it hurt? Right?
Which is still a guessing game.
Yes. Well, yes.
Yes.
Totally. What about once you get the diagnosis? I mean, that's not the end all be all, right? I mean, we're calling it the golden ticket, but that kind of gets you in the door. There's still more beyond that.
Yes.
Right?
So, you hit on this a little bit earlier when you said we don't really introduce our kids to doctors or anyone really and say, my child has KDM5C or a KDM5C genetic variant or mutation or whatever genetic condition, because there is very little research and understanding out there of what this condition looks like, how it manifests, and there's also a spectrum of how it presents in our kids.
Yeah.
So it's easier for us as parents to be able to identify with something that people understand, in my opinion.
Yeah. Oh, yeah.
And then, of course, from an eligibility perspective, there is PT, physical therapy, OT, occupational therapy, speech, which between us, we have 6 children diagnosed with a KDM5C genetic variant.
Yeah.
And the boys, all 4 boys, are non-speaking. So speech therapy, Avery is still on semi-solid foods and liquids, purees. He has not passed the swallow study. He's 4 years old. He'll be 5 this year. So feeding therapy is still on our list. And then ABA is applied behavioral analysis. And that is a specific kind of therapy that targets behaviors and like specific behaviors, I'll say more along the lines of self-harm and destructive behaviors, and how to mitigate those or de-escalate situations, how to keep yourself safe, keep your child safe. But also in our situation, it is to help him be more functional, to function in a regular environment, and for those of us around him to be able to understand him, what he needs, what he wants, or whatever he's trying to communicate.
Yeah.
But, I just rattled off the therapy names, and it's a lot. It's a lot to keep up with. It's a lot for him to go in and sit down for 30 minutes or an hour session of PT, OT once or twice a week and do that type of concentrated work. And it's also really, really high. It's also really, really difficult to see on the IEP the measures of their success or their goals when they start out, like, where did the goals come from? Why is this set? And then to see like halfway through the year, whether they are or are not progressing towards the goal. I'll use a common one with our diagnosed boys in general is writing. It is very difficult for our kids to hold a pencil or to do anything that requires fine motor skills.
Right.
So in my opinion, it's not that important to me if Avery can hold a pencil or not. What's important to me is that, he's not using that pencil to poke someone's eye out.
Yes.
He's using it to point and say, I want milk versus apple juice, or I need to go potty versus stabbing me with the pencil because he's frustrated.
Yeah. What I think, I mean, I'll go a little off topic and come back. We've talked about IEPs, I don't know how many times now.
Yeah.
But I think that's something we need to come back to because, in I know he's very young. In our case, we have elementary, middle school, and high school. And the goals you mentioned the goals and where these goals come from and how you track progress. For us, the goals have changed as the child progresses and gets older. It goes from kind of, I'll say, to trying to shoehorn the child with the IEP into what neurotypical kids would do, like writing their name or doing those sorts of things, to goals that are more centric around how do they survive in society. So
Yes.
things to do with safety or self-care or, any of those daily living skills, right?
Yes.
Those tend to be the types of goals that we had or have for our kids as they age and work their way through the school system. But
I think that's important overall because I have been so heavily focused on communication and thinking that just being in a world that primarily uses speech to communicate has to be incredibly frustrating to be around people who are constantly talking and to not be able to verbalize things. So my number one goal for Avery has been centered around communication. Secondarily, potty training has come up, which we've not started potty training with him. Sometimes I think he's ready. Sometimes I'm not ready. Like the commitment to that process in and of itself is, for me, the benefits don't outweigh the consequences at this point.
Right.
So, but when you think functionally and long term, like what's more important? Is it more important for him to be able to feed himself or to go get something from the refrigerator, go get something safely from the cabinet? Or is it more important for him to be able to go to the bathroom so somebody doesn't have to wipe? Like, in my opinion, it's more important for him to be able to eat.
Yeah. Yeah.
And so that's like, those are the kinds of decisions that we're making or trying to make to advocate for our kids to drive a sense of fulfillment and independence.
Well, and yes, fulfillment and independence, but I mean, like safety too. I mean, I mean, I give the example of like, where does it hurt, right? I mean, because our kids, in particular, they may cry if they hurt themselves, but a lot of times they won't, just because their pain threshold is like through the roof.
Yes.
So if they're showing symptoms of pain or discomfort or whatever, it's because it's really bad.
Yes.
Right. And not knowing not them not being able to tell us where the problem is or what the problem is not only frustrating, but, potentially dangerous.
It is.
So just in the interest of time, what do you think in terms of, I'll say, overprescribing or overusing or overloading, not just the autism diagnosis, but any type of diagnosis?
So my personal opinion is we underutilize neurospicy. We underutilize neurodivergent because if you think about it, we're all probably neurodivergent. We all learn things similarly, differently, and on our own terms, at our own pace. And I think the more generalized autism diagnosis has become somewhat diluted over the years because there are parents like us who need that. And even though we look at our kids and say yes and no, but more yes than no, we desperately need the services. We want our kids to be able to have as neurotypical a life as possible with all the ups and downs. And we cannot get access to services without these big diagnoses.
Yeah. Yes. Which sucks.
It does suck.
That's no other way to put it.
Yeah, it sucks. It sucks because, do I think Avery is autistic? Yes. Do I think I think Avery is Avery, but I think that by looking at him as an individual, we should be able to say, okay, we need to work on A, B, C, D, and E as a person, not because of a diagnosis. We want him to be able to put his shoes on, not tie his shoes, put his shoe on. I want him to be able to pull up his pull up. He can take it off. Can he pull it up? No. Functionally, I want his goals and his therapies and what he's eligible for to be based off his individual abilities and not off of some standard assessment or a medical diagnosis that may or may not be truly reflective of who he is and how he shows up in the world.
Yeah, absolutely. Absolutely. Good job.
So we had to do a short episode today. Do we have anything else on our... What else do you want to say about this?
I want to know what everyone else thinks.
I do too.
Right?
Autism is a huge, huge conversation. I've been a pretty big advocate in this space for the better part of 3 years now. And not just for Avery, but for any of our neurospicy kids or all kids, I guess you could say. And I'm curious, what do you guys think? What do you see? What have we left out? There's a lot. This is a big conversation, just the tip of the iceberg. We might have just drove the Titanic into the iceberg.
I think so. But that's okay,
Yeah,
We found the iceberg.
He knows I'm not a good driver, so we'll see. I hit a few cards.
I only have one.
All right, folks. Until next time, I'm Jess.
I'm Johnny. Let us know what you think.